Shall I share my screen?
So you can begin, Madhu.
Okay. Good morning from my side to everyone, and good evening. And today we are discussing about the important topic, second prescription. Actually, I was having so much problem. Then what to do in the follow-ups? So I asked sir, what to do? He said, okay, read it and whatever you understand, explain it to us, and we will discuss it in a group, right? So for Karina and me prepare the presentation, and I'm going to present it. I'm going to share my screen. Okay. So firstly, we will be discussing what is actually the second prescription. So when we go to the doctor for the first time, and the doctor takes the case in a very extensive way, like we take the case in a very extensive way. We take all the symptoms of the patient, of the disease, we take care of his mental and his lifestyle, environment, everything. And then we do the analysis, evaluation, make the totality of the symptom, do the repertorization. We do everything what is best, and they select the most similar remedy. And then we ask the patient to come after a certain period of time. And we wait for that time, right? So after the patient comes after, like for the follow-up, second time, we see some responses. It can be aggravation, it can be amelioration, and then we prescribe some other remedy or change the potency. So this observation of action of previous remedy, analysis of the case in the follow-up time, and selection of the remedy or change of potency is called second prescription. It is the prescription after the first one has acted and evoked a response. It can be the third prescription, fourth prescription, fifth or sixth. So all are considered to be second prescription in respect to the previous prescription. So basically this is the follow-up. What we do in the follow-ups is the second prescription. It can be first follow-up, second follow-up, third follow-up, right? So how do we know that a prescription has acted? We know that second prescription is when the previous one has acted. So how do we know our prescription has acted? So in this follow, we will see, okay, some symptoms are disappeared. There may be aggravation to the patient. Some symptoms are getting better. And the symptoms have changed the order, like new symptoms have appeared. New symptoms of the disease, new symptoms of the remedy. So there are so many things which is happening and which tells us that our previous prescription has acted. Good in a good way or in a bad way? No, this is like it has acted. So, and we are waiting for the cure. When the patient, we prescribe a remedy, when he comes to us, we're like waiting for the cure. What does actually cure means? So is it a mere disappearance of the symptom? Yes, but in a certain way, like Herrings gave the law, when the symptoms take the direction of a cure, then it has to move from within outwards. Like the vital organs have to be affected first, relieved first, then the periphery, like the brain, heart, lungs, they have to get better first, and then the outer symptoms. So, and the symptoms move from above downward, like the head, brain, lung, and the extremities, the joints, some problem with the tendons. So we take the example of the patient comes with us for thyroid disorders, like heart disease and skin complaints. So his skin complaints should get his heart complaints should get better first, and then his skin complaints. So the vital organs should be better first. And the third thing is the symptoms goes in the reverse chronological order in which they appear. That means the latest symptom, the present symptom should be better first, and then the preceding symptom. It's not like that the patient comes with heart disease and psoriasis. So first if we see the vital organs and periphery, yes, this is the interesting thing. If the vital organs are affected first, they should be relieved first, and then the periphery. But if the skin symptoms are latest, then what should be done? Like the latest symptoms are the skin symptoms, and the patient was already having the cardiac symptom, then what should be the direction of the cure? Ma'am, can you please tell?
Can I tell you? Well, yes. this follows a little bit differently than what Hahnemann explains.
Yes, I have
Actually,
the other slide for what Hahnemann said
yeah.
also.
So sometimes there can be a return of symptoms in the skin when dropped. Okay. Yeah, so if old symptoms like the old skin symptoms return, that can be a very good sign.
Yes. So
And
this is what Hahnemann say about the cure. If an old symptom returned during an antisoric treatment, it means the remedy is affecting Sora at its root and will do much for its thorough cure. Yes, if a skin eruption appears during the treatment while all other symptoms have so far improved, the end of the treatment is closed. Old symptoms return during an antisoric treatment. So, when the chronic diseases, the non-venereal diseases, the Sora is the cause, and the first manifestation of Sora is the skin eruption. When the skin eruption is suppressed, the infection goes inside, and there are little bits of that it goes into the latent Sora, right? And then there is a secondary manifestation, and these secondary manifestations are the chronic diseases, are the manifestations of the chronic diseases. So now we are treating the chronic disease, and we are reverting back the disease. So we are going back to the first stage, first manifestation of the Sora, which is a skin eruption. So we are going backwards. So we say in homeopathy, we treat the root cause of the disease. So this Sora is the root cause of the disease. We are going back to the root. So if the skin eruption appears during the treatment, while all the skin symptoms have far so improved, that means we have reached the root. And this way we can say that the treatment is this is the end of the treatment. So understanding first prescription and making observation in relation to it. So when we prescribe remedy, we should know that we have to make some observations in the follow-up. We should know the period required for the positive action to show itself. Like the remedy, we give the remedy, and we should not expect the remedy to act the second other day. Like we are giving the remedy 1M potency. It will take some time to act. We should wait some time for the medicine to act. How long does the action last? Okay, the medicine has acted. We should know the duration of the action. And if we know the duration of the action, we will avoid the unnecessary repetitions. And also we should know what are the type of responses happening. Is it aggravation? Is it prolonged aggravation? Is it quick aggravation? And what does this responses mean? I mean, the disease in the curable stage or incurable stage, or in which stage are the diseases? And all this combined will lead us to the second prescription. So this is important. The observations are crucial. If the homeopathic physician is not an accurate observer, his observations will be indefinite, and his observations are indefinite, his prescribing is indefinite. That means we should be knowing what we are observing in the patient, like not taking all of the symptoms. First of all, we should be an unprejudiced observer. Our preconceived notion should not hinder our case taking. Our mind should be blank. With a blank mind, we should take the case. And then we make the totality of the case, like patient totality, disease totality. This disease totality will decide the case is incurable or curable, or in which state the case is. So we should be an accurate observer, like not taking everything. We should know what we should observe and what we should take. And this observation will only lead to the correct prescribing. So Dr. Kent has given 12 observations. These observations are the ones when the patient comes to us for the follow-up. And what are the responses he gives? Nature of response. It could be aggravation, it could be amelioration, and there are so many responses. And what is the cause of this response? Because of the disease state, because of the medicine, because of the potency. So we should know what is the cause behind this response. Now, and what to do? This is most important. We know what is happening. We know the nature of the response, but what to do in that situation? So first situation or first observation is that the patient comes with prolonged aggravation with a final decline of the patient. Am I going too fast or is it okay?
People,
Yeah, it's fine, but slow means don't accelerate.
Okay. Actually, my speed is very fast. Okay. So for the first time, the first observation, we are waiting for the cure. But this time the patient said, okay, my problems are highly aggravated. I'm feeling so much worse. And the patient is going, his strength is decreasing. And there is a decline of the vital force. And there is a decline of the condition of the person. So the nature of response is slow decline of patient strength. And why it is happening? What we did? Because the case was in the advanced organic changes. It was in the incurable state. And what we did? We gave him the deep acting remedy in the high potency. And the remedy was given too late. So the case was already incurable in the advanced stage, and we gave him the high potency in the deep acting and the deep acting one. So what should we do now? We have worsened the thing now. We have aggravated everything. We should antidote the effect by selecting the best possible remedy on present situation, and we should give in lower potency. The vital force is very much disturbed at this time. It is very weak because of the advancement of the disease. And if we give the higher potency and the deep acting remedy, it is only going to harm the vital force. So we have to, give the lower potency. What should have been done? In these type of cases, we should palliate with short acting remedy in lower potency and do not give a deep acting remedy. So what can be the other situation? In this, there was a prolonged aggravation with final decline of the patient.
What the first says?
Prolonged aggravation with a final decline of the patient.
Decline of the patient, right? Means once you given a medicine and patient goes on aggravating, and then the patient lands into collapse state.
Yes.
But he doesn't come out of the state. Or he may come, or it's really gradual. It's actually what it's saying, prolonged aggravation and final decline of the patient.
Yes.
Means he is not coming back. That means the case is incurable.
Yes. And we should not give the deep acting remedy in higher potency.
Right.
We should always give the short acting remedy in the lower potency. The second observation, what we see in the follow-ups, the patient will say, okay, my condition was aggravated for a week, and then I felt little better. Then I start feeling better. So aggravation is long, but finally slow improvement. In this case, the improvement was there because the case was not advanced to incurable stage. In earlier, it was the incurable stage. There was no improvement. Now there is improvement, and the aggravation was long because we gave the too high potency. And this is a good prognosis because finally the patient is improving. And what we should do? We should not repeat the remedy too soon because still the case is advanced, and wait until the patient has sufficient strength to react to another dose. In low vitality, start with the lower potency. So this is also the case which is in advanced state but not so advanced. So start with the lower potency. And this one is like short, quick, and strong aggravation followed by long-lasting improvement. There was aggravation, but it was for a very short time. And there was a long-lasting improvement. Oh, this feels good. We like to hear this. Okay, aggravation was there a little bit, but there was a long-lasting improvement. And in acute cases, aggravation is in the first few hours. Like for first few hours, the patient will feel little worse, but then there was improvement. And in chronic cases, The aggravation is in the first few days. And why this response was there? Because the patient, there was no structural changes in the vital organ, and there is no tendency to the structural changes also. Though maybe in the parts not essential to life. That means the vital organs was not involved. And this is the good prognosis. We should not do anything, and we should wait for the symptoms to return back. And this is the very good response which we want in a clinic. No aggravation or very slight aggravation with recovery of the patient. This is a very satisfactory cure, and it is a very good prognosis. In this case, there are no organs involved, only functional changes, and the potency and remedy was suitable. So this is the highest ideal of cure. And we should not do anything and wait for the symptoms to return. So no aggravation or slight aggravation with recovery of the patient.
अच्छा ठीक है.
In this case, the amelioration comes first and the aggravation comes afterwards. Earlier, there was an aggravation initially and then the amelioration. But in this case, there is amelioration. The patient will say, okay, I feel better for a very short time, but now I feel much, much worse. And why this is happening? First case, the case is incurable. That's why the patient is feeling much worse. And the other situation is, we have given the remedy which has acted superficially. It has just palliated the case. So we should retake the case and find the true minimum. If it is an incurable case, I mean, we can just give the short-acting remedy to palliate the case. If the case is not incurable and the remedy is given just superficially, then we should give the deep-acting remedy to cover the whole case. Sixth observation is like too short relief of the symptoms. The patient will say, there was relief of symptoms, but for a very short period of time. My condition is same again. I was feeling better like for 1 week. Now it's same. And what is the situation in that case? What has happened in the patient? In acute cases, there was severe inflammation. The organs are threatened. There is a high grade of inflammation. So the symptoms revert back. There was a short period for amelioration. But in chronic cases, the organic changes are advancing. So the case is going to the advanced stage. So there was relief for a very short period of time. Or everything is going well, but there is an interference with the remedy. There may be some maintaining cause. He has handled some chemicals. There may be the use of alcohol or smoking. So there is an interference with the remedy. In this type of situation, we should try low potencies in repeated doses. When there is short period of amelioration, too short relief of the symptoms. In acute situations, the best kind of amelioration comes gradually at the end of 2 to 3 hours. Like we should keep repeating the remedies in low doses, and after 2 or 3 hours, the patient will feel better. And this will likely remain. And from now, from 7th observation onwards, Karina will present it.
1 minute.
Yes, sir.
Can you just revise all these 6 observations again?
Yes.
And
Revise just title.
there are a few questions in the chat box as well.
Okay. There's the chat box.
Yes,
Oh,
and
my
I have a
screen is-
question about why there should be so much aggravation.
Ma'am, in the so much aggravation in regarding to this prolonged aggravation.
No, in regarding to anything outside of the aggravation that lasts a very short time in an acute.
Because the case is advanced and we have given the higher potency. We have given.
What do
the
you mean by
deep-
higher potency?
It means above 200.
Above
Like 1 M
200?
potency. Yes, above 1 M, 10 M. Actually, ma'am, I myself know the case where the remedy was given in 1 M potency and the case landed into the ICU.
Was it a
So-
dry dose?
Yes,
How many pellets?
4 pallets, 4 to 5 pallets. Like
4 to
repeatedly
5
was-
pellets, a 1 M and a dry dose with a
It was
patient that
repeatedly
isn't
given.
absolutely thriving will cause an aggravation. It's a fact.
Yes.
This is why Hahnemann gave us the water dosing and the very carefulness of the dose. This is not careful prescriptions.
Yes. And that's what we have to learn here, that we should not give deep acting remedy in the higher doses.
Or any,
Advanced,
no, it's
yes.
more about the dry dose and the quantity of the medicine. The
Okay.
quantity and the dryness of the dose makes a huge dose, and then that's just too much medicine.
Yes.
And that's
yes.
going to give the patient an aggravation. And we want to try to avoid aggravation as much as possible. And the first sign of a patient recovering is that they usually seem a little perkier.
I'm sorry, ma'am.
They usually seem a little perkier, a little happier, a little more cheerful. It's almost imperceptible. But we don't want to do this kind of dosing that will give aggravations to our patients.
Yes, definitely.
So we want to use water, and we want to use 1 or 2 pellets in water and never repeat a dose. This will help prevent a lot of this, even when there's advanced disease, even when the patient's dying, even when the patient is incurable. It'll help prevent a lot of this because we still have to help our patients even when they're not well. Okay.
Yes, ma'am. Thank you.
Okay, just
I cannot see the chat box because my screen is short.
you can just list those all 6 observation. And one more thing, this is not about aggravations. It is about action of remedy. Whatever action will come, that how we need to judge the action of the remedy.
I see a lot of the word aggravation when we read about Kant's observations for the second prescription.
Yes.
And I think that a lot of it's unnecessary. But then again, Kant was working on the 4th organon, and it seems like he didn't even read the chronic diseases.
Okay. Ma'am, but there is something to learn from this aggravations also, that we should not give the deep acting remedy in the higher potency. That's what I learned from this thing. And the stage of the, the case, that whether it is advanced or whether it is an incurable stage.
Yeah, but lots of people, we won't know if they're incurable or curable. And cure might take years. Can't underestimate the vital force.
I think the key here is to look at the vitality of the patient before prescribing. That is key. A patient comes in and their vitality is really, really low. I think Kent was more of a warning or a caution, would take more caution. His response was, if the case is very low vitality, if the disease has caused some structural changes, tissue damages, organ damages, tread cautiously, go with low potencies, but again, do not repeat frequently. His idea was to observe, to wait. And in his earlier observations from observation 1 to 6, which Madhu was speaking about, he did focus on aggravation and the idea of trying to avoid those aggravations as much as possible. So the idea was to look at the case carefully. Once you get the remedy, choose the potency wisely based on the vitality and the prognosis of the patient. I personally have found water doses to be much better, even if it's not even directly from the cup that you put the pellets in, but you dilute it even further into multiple cups. We used to call those the 5-cup dilution method, where you actually take a teaspoon from the original dilution and you dilute it over again and again into 5 cups, and then the patient takes the medicine from the 5th cup.
Yeah, which is a very valuable tool. Valuable tool
Yeah, that has worked really, really well. Personally, I have used it myself because I tend to be sensitive to homeopathic remedies. And I find that that has worked and has prevented aggravation. Usually, even to the most extreme cases, and they're very sensitive, they may aggravate, but it's so mild and it's so short that it's practically negligible. But it doesn't mean not to go high. I mean, I have seen cases, amazing cases, especially with children who their vitality is really strong, and you give them a dose of a 1N. It works fantastically, but you have to pick and choose how you're going to dose, and you have to pick and choose and see your patient, observe the vitality. That's really, really key. But Kent, in his first 6 observations, he was more cautious at this point in time, for sure.
Okay, which observation are we up to now? Number 7?
Yes.
Shall I go ahead and share my screen, Madhu? Do you want me to
Yes.
take over?
Yes, please. I guess Sanjay sir is gone. There's problem with.
Oh. Okay, sure. Okay,
Yes.
I'll share my screen. Thank you, Madhu.
You guys sure made some really fancy PowerPoint.
It was actually a lot of fun, and it's great to go back and kind of reread this information. You know, my son, he's 14, and he asked me, you know, why are you going back and rereading this information? And I actually compared it to math, and I said, do you remember when you just learned fractions and you go step by step? But then over time, you start doing it out of memory, and you're so quick, and everything becomes subconscious that you end up kind of cheating your way through. And that's how I explained it to him, because I said, this is sometimes, as homeopaths, what we do. We sometimes skip the basic steps, and we feel so confident that we forget the basics, and we forget to look in detail into the cases. And what this does is it takes us back to theory, takes us back to Hahnemann's teachings, and it's great because it's refreshing it while we're taking cases, while we're seeing new patients. So I love this. I have to appreciate Sanjay and Tikva for doing this and getting this together. It's amazing. It's been really, really helpful for sure. I want to just differentiate one more time before we continue on with the observations with the first prescription and the second prescription. Okay, Kent was really clear when he talked about the first prescription. It is the prescription, the remedy that has acted. Okay, you can give a dozen different remedies, but if none of them have acted or affected a response from the patient, then those remedies are not the first prescription. The first prescription is the first remedy that has evoked a response. And the second prescription is the prescription that follows the remedy that has acted. So the second prescription actually can refer to the third and fourth and fifth remedy, as long as it's after a remedy that has acted, and that being the first prescription. So I hope that that was clear to define the two prescriptions. And
Yes.
in my practice, I find that the first prescription is almost easier than the second prescription, because I take all the information, I take all these observations, and and everything, the mannerisms, the histories, the current symptoms, the old symptoms, parental history, and you take all this information and you give the first prescription. Second prescription is a lot more complicated, because the second prescription, not only are you looking at all the information you used for the first prescription, but you are also looking at the responses that they've had for your first prescription, as well as what to do with those responses. Do you wait? Do you act on it? Do you change the remedy? Do you continue the remedy? So the second prescription is is much more complex. And I think Kent touched on those with these 12 observations for sure. So to continue Madhu's presentation, the 7th observation says the full-time amelioration of the symptoms, yet no special relief of the patient. So think of this observation as a glass ceiling. Okay? Your patient is only, sometimes, some patients are only going to be able to get better only so much. And this is when we have to realize that homeopathic remedies also have their limitations. So if you have a patient who's had only one kidney, there is tissue damage, there is organ damage, they will suffer. So there is a point in time where the homeopathic remedies can only do so much. Same thing, I had a patient who came into me, and by the time he came to me, he had 2 heart attacks and he had about 6 stents placed. And in that aspect, he has to be on certain allopathic medications. There was no way he could get off of it, because even at that point, homeopathy can only do so much. So this is really important that they, on the remedy, they can get certain amount of amelioration, but they will not increase in strength. Like, there is this glass ceiling. The patient is just too weak for restoration of health because organic changes are present, and we must realize that complete cure is just not possible. So at this point in time, we will look at palliation. What does palliation really mean? Palliation is try making the patient feel better. You know the limitation, you know that it's not going to be 100% cure. So you try to make the patient feel better. And this is ideally done with lower medium potencies. Don't repeat it too often, because you don't want to cause more structural changes, or you don't want to send him into an aggravation. So tread cautiously, but go with low and medium potencies, and recognize that there is a barrier to how much the patient may not overcome that. And that's usually if there are structural or organic changes.
Yeah, the dying patient is its own topic, and a very important one.
Yeah, for sure. Okay. Okay, the 8th observation. Now, this is interesting. This is basically you're dealing with a patient who's extremely sensitive. So what happens is they prove every remedy. You give any remedy to them that you think is suitable for their case, and instead of acting the way they should or responding, it's almost like the remedy engulfs them and does what a disease would do, and they develop all these symptoms, just what the remedy is. So if you give pulsatilla, instead of them responding favorably, they start becoming an ideal pulsatilla patient. So in Ken's observation is he said that these cases are really hard to treat because you're getting mostly proving of the remedy. You're not getting these favorable responses, but they make excellent provers. So if anyone hasn't read Jeremy Sher's book, I believe it's Dynamics of Homeopathy, or I should double check that title. But it's an excellent book. It talks about proving, it talks about the necessity of provings, it talks about homeopaths should do the provings because they are not only a benefit to the science, but they are also a benefit to our own health. Once we do a proving, they actually benefit us physically and mentally and emotionally. But yeah, these patients who prove every remedy, they end up being really excellent provers. And in the 9th observation, he actually goes on and talks a little bit on that. And he basically says that make sure to note the constitutional state of the individual before they become a prover, because you need to subtract that state, those symptoms from the provings. But if that constitutional state has changed in any shape, way, or form with the proving, with the remedy, then you should note those changes down, because that is, again, the effects of the remedies. I really encourage everyone to read Jeremy Sher's book. When I get a chance, I'll just put it on the chat, the name of the book, but it's an excellent book about proving and how it's so necessary to continue Hahnemann's work with different remedies. The 10th observation is new symptoms appearing after the remedy. And this is really important because you have to make sure with this that it's not really a return of old symptoms. And what happens is when you have a patient come in, they really don't remember sometimes an old symptom. So they may have an old fracture, and I've seen it with injuries where they have an old fracture and they don't even remember because they were 3 or 4 or 5 years old when it happened. And it could be, you know, on the wrist, and it's insignificant because the body, the vital force has reacted in such a way that it doesn't produce symptoms anymore. But probably the healing wasn't 100%. So what happens is when you give their constitutional remedy and they start feeling better on an emotional, mental state, but they get the return of the old symptoms, suddenly their wrist starts hurting and they don't understand why. They don't really remember that it's an old symptom or an old injury. So for you to make sure that it's genuinely a new symptom, you really have to press, are you sure that this is not a return of an old symptom? Have you had an injury that you really have to go on questioning? Have you had an injury? Do you remember having a cast put on or anything like that that can jar their memory? Because, you know, if it's happened really years ago, it may be an old symptom that they're not aware of. These new symptoms in this observation are also not part of the drug proving. In this situation, if they're developing a whole bunch of new symptoms, chances are it was a wrong prescription, and your best option at this point in time is to retake the case. And if you retake the case, include these new symptoms, as well as all the other older symptoms that they've had, and take all of that into account. And sometimes the new symptoms can be a really good guide to the second prescription if those symptoms are characteristic of the remedy. They'll likely cover the whole case. But the rule of thumb is always study your case again. You know, that is the best thing to do. The 11th observation is when I was just talking about the old symptoms are observed to reappear. And that is fantastic. It goes with Herring's law, direction of cure, and the symptoms return in reverse order. So for example, you have a patient who is asthmatic, and it's, you know, it's common practice when you're treating asthma as part of their constitutional remedy that, you know, the asthma may ameliorate, they may start feeling to breathe better, but then skin ailments result. And those likely were the precursor to begin with, but were suppressed using steroidal treatments, etc. And they were suppressed. So you really want to watch out for those older symptoms and wait, because it does indicate that your remedy is deep acting, it's attacked the disease in its innermost nature, it's, you know, helped with the asthma, which is more detrimental to health and vitality as opposed to the skin, and the ailment has come on the periphery. So your best bet is to wait. Do not be in a hurry to, you know, sometimes the patient or the patient's mother may come to you and say, you know, these boils have come back and they're really ugly looking, and they may push you over the edge to prescribe something because they don't like the way it looks. But it's really important to educate your patient and to teach them a bit of homeopathy at this point in time, that these old symptoms will disappear in a short while. And our best course of action right now is just to sit back and wait and see, you know, check the duration and action of your remedy in Gibson Miller's relationship of remedies and Borky. You'll see the duration of how long a remedy is acting. And then you can base your call, you know, if these older symptoms persist for a really, really long time and they're getting worse, then you may use that for your second prescription. But if you wait, you may just realize that these old symptoms go away and they get milder. They don't increase in intensity if it's the correct prescription. And the last observation, the 12th observation, is a marked improvement with the current symptoms. Okay, the patient had rheumatism of the knees and the ankles, and they've come to you and they've said, okay, this is really troubling me. You do a great prescription, and they come back and they say, you know what, I really feel better with my arthritis in the knees and in my ankles. But you know what, my spine and my heart, something is wrong with it. I feel these palpitations. This is when symptoms are going in the opposite direction. There's anxiety on the mental and emotional sphere. You can sense fear. They're worried. Their heart is affected. So this is when the movement from the periphery has gone internal inwards. And this is not what we want. In homeopathy, we do not want to see this kind of change with the symptom picture. It shows immediately that it's an erroneous prescription. It hasn't been based on totality of symptoms. You should antidote the remedy immediately according to Kant and retake the case, use the totality of symptoms. You have to use, again, all the symptoms. So these new symptoms that have occurred, you must take them into account with the case as well. So these are the whole, the 12 observations. The correct prescription is another book, and they go, and the author here, I hope everyone can see it, S.M. Gunavante. And I really love this book quite a bit because he takes information from different authors. He takes information from Kent, from Hahnemann, from Gibson Miller, from Close and Roberts, and he kind of puts it all together. And so he has added more key features to look out for. But this was a basic summary of everything. And obviously, when in doubt, just wait. After the first prescription has been made, changes will occur. You will have this coming and going of symptoms. And while these changes are occurring, no rational observation can be made of the case. If the second prescription is made during this time, you will likely spoil the case. So when in doubt, just wait, give it some time. Sometimes I find the patients themselves are in a hurry. They see some amount of improvement with the remedy that you've given, and they just want to push harder because they feel, if they take more of the remedy, or if they have more doses, or they see you again, they feel like they'll just be 100% better in the next 3 weeks. And I've had patients really press on. I have to do that education to the patient and say, wait, hold on, because we want your body to do the healing. Remember, in homeopathy, it is not our drugs that's doing the healing. We are just starting the ignition to the vital force. But at the end of the day, it is the patient themselves, their own vital force, doing the work and healing themselves. So whatever time the vital force needs to take, and that differs patient to patient, we really, really need to observe that and wait. The best cases I've had are the cases that I've waited even months before prescribing. And it's hard to do in today's day and age, where people are so accustomed to allopathic medication and taking it, on a daily basis. They're really not used to something that we tell them, take one dose and then repeat it 3 months later. They're really not used to this concept, but we really have to explain to them that we're just starting the engine, but your vital force is what takes off. And if your vital force is continuing to respond, there is no reason to interfere. So I think that is the big takeaway in the second prescription. And if you have any questions on these observations, feel free to ask. I'm gonna stop sharing at this point because Madhu will take over. But if you have any questions, please ask away. Any questions?
Okay, guys, it's time for questions.
No questions? Okay, Madhu, I think you can continue.
I think the question those who have asked has left the meeting.
Okay.
So there is no need to answer those questions.
Okay. Madhu, you can continue.
Okay.
Is
So, sir, can you?
Is this different or it is same?
Here's the
No, sir.
question.
Yes.
I have to bring up my question box. You guys got your question boxes open? If during treatment of chronic cases, acute disease comes, what would be the second prescription? What do we do if an intermittent disease comes during the chronic?
We give the remedy as per the symptom totality at that time. We read that in intermittent remedies.
Yeah, so what you want to do, guys, is you want to take care of that acute disease, leave out all the chronic symptoms, and take the current state and treat it, and then retake your case when the patient's well again.
Yes. Shall I continue? These are the situations when we decide when to repeat the remedy in the same potency, when to give the remedy in the higher potency or the lower potency, and when to administer a complementary remedy or to cognate a remedy. There are several situations when to give entirely a new remedy and when to we want to give this a succession of remedies, like giving one remedy, then the other layer comes out, we are giving another remedy. When to change the plan. Okay, we did some blunder, we did the wrong remedy. It is now the entirely change the plan. Wait and watch. When to antidote, when to intercurrent. So we will go detail in each of it. Because, yes. So when to repeat the remedy in the same potency. I have the habit of repeating it again and again and again. But I should learn it that when the symptoms ameliorated and after some time, patient returns with the same image, but with less intense symptoms. The symptoms got better, and after some time, there were symptoms with the same image, like the patient is having throat pain, but this time the intensity is low. That time we have to repeat the remedy. The time to repeat the remedy is the first remedy. Time to repeat the first remedy is when the improvement has stopped. So, amelioration was there. Now there is no improvement. Okay, we repeat the same remedy. However, do not repeat a remedy that is still acting. If the remedy is causing us some reaction in the body and we keep on repeating it, then it will disturb the action of the remedy. It's like one hammer is enough, but we are putting like 2 or 3 and 4 hammers, but one hammer is enough. So we should not repeat the same remedy when the remedy is still acting, and when to go for the higher potency. After considerable amelioration, there is no complete relief. After repetition of the same potency, there was cough. Okay, there was dry cough, and we prescribed the Drosera in the tincture form, and it relieved the cough for a while in the daytime. But when the patient go to the bed and he lies on the bed, the cough is still there. He's still taking the Drosera tincture, but no, there is no relief. Now, when we give the higher potency, the Drosera 30, that time we see, okay, the patient is getting better. So some symptoms are still there, even after repeating the same potency, then we have to go to the higher potency. And when to give the remedy in the lower potency. Then there's long aggravation is followed by decline of the patient. Okay, we have done aggravation to the patient. We have given the remedy in the higher potency. That time the same remedy given in the lower potency will palliate the case. It will antidote the remedy. Useful when immediate amelioration is followed by prolonged aggravation. Incurable case and you need to antidote or palliate. This time also the case was in an incurable stage and we have caused the aggravation. So we have to palliate with the lower potency. When the patient is too sluggish, initial dose of high potency followed by low potency to continue the healthy reaction. Okay, the patient is too sluggish to react. The reaction is very slow. That time to initiate the reaction, give the higher potency, the action has started, and then continue with the low potency. When to complement the remedy. So This is like when the remedy has given considerable relief, but no further progress is witnessed, even after escalating in the potency. We are giving Nux vomica, 30, 200, 1M, but there is no further progress. We have reached to 10M. Now what to do? Now we have to complement, we have to give the another remedy, which is complementary to the previous remedy. And there is another situation. The first prescribed remedy is an acute one and it relieves the patient for some time. But repeatedly, the same symptoms will appear with the same intensity. It's like there is post-nasal discharge. The patient is coming with post-nasal discharge. And with the symptom similarity, we are prescribing the pulsatilla. Okay. Again, the patient will come after 15 days. Again, we are prescribing pulsatilla. So this is the acute stages coming back again and again. So we see that this is the acute exacerbation of the chronic disease. And we have to take the case in the totality. And this time we have to give the deep acting remedy to stop the recurrences. So the chronic of the pulsatilla is Sylesia. If the symptom totality is there, we should give Sylesia. In such a case, the acute remedy is to complement it with some deep acting remedy to stop the recurrences. There are a few examples. In acute stage, if the belladonna is indicated, there may be a possibility that the calcarea carb is the chronic of the case. Sylesia is the chronic of pulsatilla. Natramune is the chronic of ignatia.
Or we could even say that after we've used some of these lighter acting remedies, that we need to go to a deeper acting antisporic remedy.
Because there is a repetition. The symptoms are coming back again and again. And in aphorism number 5, I guess it's written that when the symptoms are appearing there, coming again and again, there is a fundamental cause behind that disease. So the chronic miasm is the root cause of that acute exacerbation. So we have to give the deep acting remedy to stop the reoccurrences. And that deep acting remedy should be the complementary of the acute one. Like it will enhance the action of the acute one. Okay, my screen, I'm not sure. Cognate of the last remedy. Some remedies work well in cyclical order and they are closely related to each other. These are different from the complementary remedies. The complementary remedies, the symptom picture is generally same, but when a cognate is used, there has been change in the symptom. These medicines are so closely related to each other that the medicine will always lead to one of its cognates and completes the cure. For example, we take the case of pulsatilla. The patient comes with the symptoms of pulsatilla. We give pulsatilla. Now we give the Sylesia. Now the symptoms, totalities of the Sylesia. The chronic of pulsatilla is Sylesia. Again, the pulsatilla, again the patient will come and say, now, I am again having those post-nasal dripping. This time we see the cycle is going on. We give pulsatilla, we give Sylesia, and there is no complete cure. This is the cycle which is happening in the body. This time, if we give fluoric acid instead of pulsatilla, the symptom totality must match. So instead of pulsatilla, we give fluoric acid, then we can stop this cycle. So this is like, these remedies work in a cycle. Pulsatilla, Sylesia, fluoric acid. Am I clear? Or you have to add anything into it?
Are you using these just without case taking?
No, ma'am, I have this, for cognate, I don't have any experience, but with pulsatilla and Sylesia, yes, I have experience. Because
there's many such charts that people share here, there, and everywhere that they get from books that give to do this, instead of necessarily, working with the patient and seeing what looks like it should be best coming next. Just curious.
Yes, ma'am. I personally don't have experience with this, but if you have experience with this, can you please share? Have you ever used the cognates?
Sometimes, but not usually.
Okay. Does it help?
Does it help?
Was it helpful?
I usually just take the symptom picture as it shows, which may or may not be any of these cognates.
But maybe if this, I have seen that if I give pulsatilla and then the symptoms are relieving for a little while, then the symptom total, this is the exact case I have. Then the symptom totality was of silesia. I gave silesia, but again the pulsatilla, this acute state was still there. Again, the patient comes back with the acute stage. After reading the cognate, I think I should I should consider the fluoric acid or some other remedy which is a cognate of pulsatilla and silesia, if the cycle is still there.
Sanjay, you use these cycles, right?
No, not really. Actually, I have seen use this pulsatilla, silica and fluoric acid, but with the symptom. I have observed that after pulsatilla, the state of the patient completely changes from warm to chilly and lands into that silica state. And after you prescribe silica for that state, then it will again bounce back into pulsatilla. Means again the patient will show the similar symptom that which you have given pulsatilla. So that time it will go round and round and round and round again. So to break this cycle, fluoric acid work really fast to break the cycle of this changing states.
But what if somebody needs calc after their pulsatilla?
Then we should give calcium. But in those cases where there is a cycle, I guess when there is a cycle, then we must consider a process. I will try in my practice, then I will let you know what this did to my patient.
So any questions?
Searching something? From here onwards, Karina will present. She will be talking about the change of remedy and the other possible things we can do with the second prescription.
Okay.
Let's stop sharing my screen. Yes. Ma'am, you were searching something?
Thank you, Madhu. So to continue where Madhu left off, there's so many reasons to change a remedy. One of the main reasons is really the remedy has no effect, and that is when the last remedy has really not acted at all. And one thing to note is it really doesn't make a difference whether the newly selected remedy is incompatible with antidotal or inimical. You just use it based on the totality of the symptom. Don't worry about what you've given before because the remedy did nothing. It had no effect. But before you go to that course, you must verify that the patient did nothing to interfere with its action. So we know in homeopathy are things that
Hello.
yeah, can everybody hear me?
I can hear you.
Okay, great. So just make sure that they haven't done it. In my practice, I have seen eucalyptus, I've seen strong peppermint interfere with the remedy. So that is something you want to verify that the patient did not inhale some eucalyptus or peppermint or had some peppermint that could have interfered with the action of the remedy. Also, before you change the remedy, make sure that your potency was really, really fitting to the case. Perhaps it was really too low, and in that case, you may try increasing the potency. Or the patient was just really sluggish and you just didn't hit the vital force. So in that case, you may try, and if you're still certain of the remedy, try again, increasing the potency, give one dose, try to jog the system, jog the vitality, wait, and then you may actually follow it with the lower potency if it's suitable. But if you are going to go with changing the remedy and you feel that, okay, it really did not act and there was no interference at all, and it's not a question of potency, but a question of remedy, retake the case and keep in mind that the last appearing symptoms still remain as the best guide to the next remedy. And again, those symptoms that match are characteristic of that remedy, you may cover the whole case, but look at the entire situation. If the patient has not improved and there's no effect, look at change of remedy. But if the symptoms have changed and the patient is actually improving, wait or try a higher potency if there's no more response, but you really, really want to be sure before you change the remedy. One of the ways to change a remedy is called zigzagging. And I've seen this in practice where it's a succession of remedies because the case almost doesn't unfold fully, or the patient themselves they don't reveal everything. They just focus on their current state, and it's difficult for them to go back in time. So you don't have the full case. And when you do that, you peel a layer. I look at it as peeling a layer of an onion. You have helped the current situation, and it's peeled the layer, and then all these other symptoms come out. You do want to urge the patient for the totality and for the entire case, but if you're only going to get part of cases, this really works because you're slowly peeling an onion. But make sure that when you're changing remedies and as the case goes on, that you are following Herring's law of direction of cure. And that should always be foremost in mind, that as the case is progressing, there's improvement in the right direction, above, downwards, inwards to outwards, and possibly the return of old symptoms. So those are the three things that you want to keep in mind. The other thing is what Tikva just mentioned. It's actually realizing that once you have given a constitutional remedy, you have maybe removed, or not removed, but the uppermost miasm has kind of reduced, and you don't see that. And what happens is that people they actually have different miasms working in, and the one that's beneath that may start raising its head and showing symptoms. So I had a patient a little while ago, about 8 months ago, and he started on staphysagria. He had a lot of anger issues, and his whole consult was really not based on any of his physical symptoms. He didn't have any physical symptoms. He had restless sleep, and his whole entire consult was based on his anger towards people. And the whole consult was him just expressing what other people are doing and how he's feeling based on what they're doing. And so I gave staphysagria based on anger. And after about 3 months, he started with warts, and we could see that either the thuja or metarhinum at this point in time would be helpful. You want to give the anti-miasmatic. Once you do that, you want to go back to the previous constitutional remedy, which has been helping, if the case still matches. You always have to look at whether the case still matches. And you can start that from the lower potencies and go on up, increasing. The best thing to do before doing any kind of change, and one of the main important recourses, and I spoke about this earlier, was wait, especially when a long aggravation is followed by improvement. Chances are that improvement will be deep and it will be long lasting, so you want to give it that time. A good thing to do is know what you're dealing with, right? So if you're dealing with an acute situation, then you know the remedy that you're giving is short acting, and it's not going to take long for the patient to respond. It's not going to take long for the medicine to act, and it's not going to take long for the duration of the remedy. You know it will be a short acting remedy. It's for an acute case. But if you're giving a long, deep, slow acting remedy, then you should know the duration of your remedy, and you should know that it's a remedy that takes has a long duration, chances are we'll have a longer onset of action. So give it that time to act. It may not happen within the next 3-4 days. I usually tell my patients that, you know, if you haven't seen a response in 2 weeks, let me know, reach out to me. And that's when I want to gauge whether there's been even a small change of response that perhaps the patient hasn't even noticed. It could be a change of temperature, it could be a change of thirst, increased urination, anything that's so slight that it's not painful. When we talk about aggravation, it could just be simple responses like that, you know, perspiration or, you know, more frequent bowel movements. So we're really not necessarily looking at these long, drawn out aggravations that may be painful. We can be looking for really minute responses and that it shows that the remedy is acting. So you want to just wait that out. Antidoting, and that's a really important thing. And, you know, we spoke about that in Ken's. That's when Ken's observations are really useful, because this is when the movement of symptoms are going just the wrong way, or the patient is too distressed, or you see that their mental and emotional state is aggravated. And in this situation, if you know that their mental emotional state is aggravated, or their internal organs are being affected, antidote. And the one thing I learned was, if the remedy has been given in a low potency and repeated just too often, then you can actually antidote with the same remedy in a higher potency. And simultaneously, if the remedy was given too high, you can antidote with the same remedy in a lower potency. So look into that. That was really interesting. I've used the antidote when it was given too high in a lower potency, but I actually haven't seen it in practice where if it's been given low or repeated too often in a low potency, that you give it high and an antidote. So if anyone has experience with that, please share. That was really interesting for me to find it.
Yeah, I have often used such antidoting, giving the remedy in going low.
Yeah, and it works very, very quickly, right?
Yeah, because it also works on the same law similar. It
Right.
doesn't add on the intensity of the symptom, but it will just take away those symptoms which has been aggravated. Right.
This intercurrent remedies, and we've seen this with Devira's presentation of boning housing concordances, and Tikva gave us a presentation of other remedies that work. This, I didn't want to repeat Devira or Tikva's talk, so I just added an important thing to note is when there's a lack of reaction and you know the remedy that you've chosen for the prescription is adequate, sometimes there's just no reaction. So look at other remedies that can shake off and elicit that reaction, especially if you've tried a range of potencies already. So some examples are carbo-veg, conium, opium, laurocerasus, metarhinum, phosphoric acid, soranum, sulfur, etc. I have used phosphoric acid, especially when the patient is sluggish and they've been through illnesses, acute illnesses in the past, and it's been really draining on their system. I've done this frequently where before I even start taking their case, and I just find they're so white, they've had a lot of diarrhea or, loss of liquids. And I feel that a dose of phosphoric acid might give me just a better case to go by. And I've seen a lot of success with that one in specific.
That's a good move.
Yeah, before, and then I tell them, okay, come back to me in a week and we'll take this case. And I find that that's done amazing because, you have patients that come to us, but they don't come on a clean slate, right? They've been through other treatments, other really heavy acute illnesses. And I feel that sometimes if we just clear what we can and and open the curtain a bit, we may just see a little bit better and get a better, a more accurate prescription.
Mm-hmm.
I just listed sources to see the relationship of remedies. Sources like Gibson-Miller's relationship of remedies, Bonninghausen's concordances, and Borky in the Materia Medica, you can find relationships of remedies. And I love this quote, so I just added it in by Margaret Tyler. And it says, if you take a lot of trouble with the case, when you know how, it will give you very little trouble afterwards. Conversely, if you take very little trouble to begin with, it will give you endless trouble many times repeated. And I think that, you know, that was just a good way to sum it up. So when you take your first case, just do your due diligence and make it worthwhile for your patient and yourself. And that's it from me. If anyone has any questions, I hope you found this presentation interesting. And I hope that I gave you some new information you could use for your next case.
Oh, thank you very much, ladies.
Does anyone have any questions?
What do you think, Karina?
Does anyone have any questions or any comments or any other feedback?
I feel when you were talking about intercurrent remedies and you were saying that there's a line in the board, when the best selected remedy fails. Like when you are prescribing, we are prescribing Rustox, and Rustox is the remedy and it is failing. So then we can give the intercurrent remedies. There are so many times when I'm thinking, okay, there's a case of dandruff, and I've been prescribing the remedy. Oh, this is not working, this is not working, this is not working. And I have tried all the remedies. I mean, okay, there may be some similarity in this one, and maybe my prescription is not wrong. My prescription is wrong, I'm increasing the potency. Okay, maybe we should try maybe I should try the intercurrent remedy.
We're done. If anybody has anything else to add.
Okay. I think this is your session almost, but I would like to talk a little bit about, discuss little bit about a latent Sora. Because we have seen in the first
latent Sora.
Yeah.
Latent
Sora.
Got it.
Okay. So, what actually mean by latent Sora?
Well, one thing that, sorry. No, go ahead, Madhu. This is your day.
No, ma'am, you can say. Yes, please.
Well, when Sora is like sleeping, it's there, but it hasn't been activated. That's latent Sora. And
No. It's not right to sleeping or waking. It's not right way. How can you explain?
what do you mean it's not right away? An acute disease can bring Sora from latent to active. Even the change of weather can bring Spora from latent to active. What do you mean?
That's why I am asking, what is latent Sora? What are symptoms of latent Sora?
Has anybody been following the group and watching what the symptoms of latent Spora are?
Okay, basically, can I try?
Yes. Sir, the acute exacerbation of chronic disease. Can we say this, like the acute diseases which is coming now?
Sorta. Okay.
I can explain from the beginning. Can I try?
Okay.
Okay. So there was the patient got infected with Sora, and the first symptom, first manifestation of Sora, like a skin eruption. We suppress it. the Sora goes inside into the body, to the nerves, and it is still there. And then there is some, what we call, some stimulus, not exactly stimulus, some conditions, which is like the Sora is
Triggering
coming
factor.
on the, huh?
Triggering factor.
Right. So the Sora is coming to the surface, but it is not fully flourished, we say that, and it is going back. So this is the phase of the latent Sora. But sometimes the symptom stays there, and this is the secondary manifestation. The symptoms come, like the case of the post-nasal dripping. They are coming, they are going, they are coming, going. So this we can say this is the stage of latent Sora. But when the symptoms are there for long, now the post-nasal dripping is there. It has been there for 1 year. They are not going anywhere. So we say this is the secondary manifestation. Am I right?
Right. Right. Actually, we need to understand the makeup of the body, how the body is constituted, his mental development, his physical development, his genetical build, his surrounding, his lifestyle, right? Now symptom, whatever he will be producing will be according to this constitution of the body, right? Whatever condition he has been living in, whatever mental state he has been living in, but the symptom will be produced as according to the constitution of his makeup of the body. Right. Now, can you hear me, or my voice is gone?
No, sir, we can hear clearly.
Okay. Hello. Okay. Now we need to see that if how the disease, the body is been infecting. Madhu has told once he is in contact with the contagion will infect the body. It enters from skin to move inside through nerves, right? It will spread all over the body. It will spread all over the body, right?
Yes, sir.
Eco, okay. Now, after this disease start development inside the body, after completion of development inside the body, the first symptom will appear on the surface of the skin. That is actually itch, with or without eruption, right?
Yes.
Why my screen is not going on live? Let me check. Okay. Now we will see that after completion, completion of development of internal disease, the first manifestation will be seen on the skin, and this is a primary manifestation. And this is infectious. This will spread infection to others, like Sora spread very quickly in the similar way. Now what happens once this is suppressed, right? Once this is suppressed, the disease goes inside again. The outlet is blocked. Outlet is closed. Actually, this external manifestation, primary manifestation, are outward doors for that internal disease.
It acts as a safety valve. When you have a skin eruption, it acts as a safety valve and it lets the disease out through a lesser important organ so that it can just kind of like erupt and do its thing and without harming the internal part of the body.
Right. Once this outlet is closed, now disease don't have any outlet, but disease, internal disease is very unstable, very unstable. It start banging all over the walls of the room. Huh? But on and off, whenever it finds a slight weaker part, that will give up symptom, and again that symptom will go back, right? It will not stay on the body. Whenever the weaker link is seen in the body, and that weaker link is also as according to the physical makeup and the surrounding of the patient, that individual, his lifestyle, his eating habit, his mentals, his everything. Huh? And what happens? This internal disease will start banging, this, exerting pressure on that external to seek the outlet. But it will not open so easily. But one day this will be breaking up. One day it will break up, and again now he will present the symptom on the external part of the body, and this time the symptom might not be on the skin. It could be on the any part of the body as according to his physical makeup or his constitute of the body. Right? Now, what is latent Sora is that state of Sora when disease was just banging and seeking the outlet to come outside. On and off, that will give the symptom. Right? On and
So
off.
what about when we give a remedy, like let's say pulsatilla, which brings Spora latent again? What's happening with that banging?
Actually, this latent state remains, it will not go away completely. This latent state, Sora may go in the latent phase, but latent state will not go. It will start banging, it will keep on working, it's an unstable state.
I think it's really interesting how you use the word banging. That's interesting. I've never heard anybody refer to it as banging before.
Have you heard definition of blood pressure? What is a definition of blood pressure? Blood pressure is the lateral pressure exerted on vessel walls by the blood while flowing through vessel. While flowing, this pressure is exerted on the vessel wall. Now this disease is internal. It is fully developed internal, but it doesn't have any outlet. And this internal disease will constantly try to seek an outlet. Unless and until there is no weaker link on the outside, it might not come out. But when constantly it is hammering on the one spot, we don't know which individual, it's not going hitting on this side one day, going on other side and hitting the other part of the, it's not like that, because patient is his constitution is very limited to his own makeup. his weaknesses, his strongnesses, his eating habits, his sleeping habits, his lifestyles, his mental state, his everything is very limited to him. And whenever this internal weakness will be only belong on the very particular parts of his constitution.
But what if you have one of those incredibly changeable patients where their symptoms are changing constantly, and therefore you see banging here, there, and everywhere, depending on the day or the week?
I don't think that is what that is what I actually mean, because you are saying the changing the symptoms which are actually on the external part.
No, I'm not talking about the external part. I'm talking about how there's sometimes, never mind, just never mind. Best left unsaid. Continue. Dear Sir Doctor.
Okay. Now, what I mean is this state of internal disease is just you can imagine there is something unstable element packed in the sealed box. And it's constantly hitting one part, right? And one day it's going to break, and still the time it's break, that time it will give on and off those symptoms related to that part of the body. And these symptoms of latent Sora might not need any remedies. It will just come, show their presence, and just go back.
And you wouldn't give a remedy for this?
Are you talking? Sorry, if I continue. I was just wondering, because I'm a little confused. Are you talking about the aphorism 221? Where I'm just going to read it aloud, and I'm just wondering if this is what relates to what he's saying, because I'm not really understanding. He says, an insanity or frenzy that suddenly breaks out as an acute disease from the patient's usually quiet state may be occasioned by fright, vexation, drinking alcohol, etc. But it almost without exception springs from internal Sora that, as it were, flares up like a flame.
That aphorism is about emotional distress that will keep reoccurring unless an antisporic is given after you've given a remedy that will bring spora back to the latent state. Here you might need belladonna, you might need aconite, you might need stramonium to calm that. But then you have to give an antisporic, because if you don't give an antisporic, you are going to have a continuation of the problem that relapses again and again and again. Therefore, you have to chase the chronic state, give the antisporic treatment for as long as needed, which might go on for a very, very long time. Otherwise, the patient will relapse again and again and again. And this is not particular to a mental state, but to all latent spora that erupts. Okay. So you always want to continue treatment after you've given one of the milder remedies, such as pulsatilla, ignatia, on and on and on. You want to give the deep acting treatment to clear up the internal cause. But yes, you are right to bring up that aphorism, 100%. Good job.
Okay. Now we are almost done if you both have anything to say with the final words, you can continue.
We learned a lot. While studying it, we learned a lot.
Yes, we did.
Yes.
I hope the presentation wasn't too long.
No? I will just end the recording now.
Can I just say something first?
Yes.
With all that presentation, which was very nicely put together, and I appreciate very much, one thing that you can do to help prevent these complications from happening is to never give the same medicine dry again. Never repeat a dry dose. And never give the same dose again, because I see that in these older works based on the fourth organon, that it talks about repeating the remedy. It talks about that the quantity doesn't really matter, but the quantity and the dryness really matters a lot. And I really want you to remember that in your daily practice so that your lives will be simpler and that your patients' lives will be healthier.
Yeah, are you referring to successions and so on and so forth?
Yes.
Yeah. Okay.
Yes. Whenever you need to repeat a remedy, always do it in water. I know I don't give any dry medicine ever. I haven't for probably 10 years. So yeah, you want it to be in water. You want there to be succussions between the doses, and that will help prevent a lot of those situations that were mentioned in the in your PowerPoint.
Okay. I will just close the recording now. Then we will talk.
But thank you guys. Good job. I appreciate it.
Thank you for having us.